We are back with Dr. Robert Cornell talking about penile prosthesis. Dr. Cornell, it seems kind of strange. You're putting an implant into a very private and very personal part of a patient's anatomy. Who's going to see it? What's it going to look like? Is it going to be obvious?
Yeah, this is a three-piece inflatable device that really is put in through a small 2-inch, 3-inch incision under the penis, right at the top of the scrotal sac. So everything is buried. Everything is invisible to the onlooker, to your partner, to anybody in the gymnasium shower. Nobody knows that you have this device. You can go through the airport security. There's no metal components. There's no external components. Everything is put in through one single incision in the midline that heals without a scar.
Okay, so externally, it's as if you've never had any surgery at all. Okay, now what about...
Nobody can tell that you've had the surgery. That's correct.
Right. So, but for yourself, if you're the patient and you've had it put in, you certainly know what your anatomy was like before you had surgery. Mm-hmm. After surgery, does your anatomy change from your perspective? Does the length of the penis change? Does it get shorter? Does it get wider? Is there any perceptible difference in that regard?
You know, the concern that most patients have before they receive a penile implant is, how much length am I going to lose? Is my penis going to be shorter? That's the most common question that patients ask me. And the short answer to that question is you should lose some length, really about an inch. But my response to them is, would you rather have a 6-inch penis that gets fully erect or a 7-inch penis that you can't use? And I think that they begin to understand just, they put into proper perspective the importance of what they're getting for that loss of length.
What do you mean? What do you mean you should lose an inch? I don't understand that.
Well, you don't always lose an inch. The elasticity of the erectile tissue in each man is different. Diabetics will have less elasticity than hypertensives, and those that do not have vascular disease but have had their prostate removed for cancer have a neurologic deficit, and their tissue, their vessels really should be fine. So each patient is different. But I do a ventrophalloplasty, which is a special plastic surgery procedure during the operation that increases the cosmetic length of the shaft of the penis by a third. So they're gaining a 30% perceived shaft length and really only losing about an inch. And why do you lose an inch? Well, you're making incisions deep into the erectile tissue. And anytime you make an incision, it heals with a scar. Well, scar contracts, and scar is not as elastic as the rest of the body.
Got it.
So when that heals, it will shrink a bit, but we can do some plastic surgery work on the outside, on the scrotum, that will increase the apparent shaft length by about a third. So functionally, patients don't lose much at all.
What about sensitivity?
There's no change in sensitivity whatsoever. All of this work is done on the undersurface of the penis and at the base. The sensitivity comes from sensory nerves to the skin and at the head of the penis, the glans penis, where most of the blood vessels and the nerves terminate. There's no surgery anywhere near that part of the body.
Okay, so it almost sounds by implication that what you're saying is if sensitivity is not affected at all, then presumably neither is orgasm, correct?
There is no change to your ability to ejaculate. There is no change to the sensation during an orgasm. And there's no change at all to your urinary symptoms. This does not involve the urethra or the bladder. This is simply 3 components. One is put in the scrotal sac, which is the pump you use to control the device.
Yep.
It's about the size of your thumb.
Mm-hmm.
There's a small balloon reservoir that is buried through that single incision in the scrotum beside the bladder in the pelvis, which is never seen or felt.
Right.
And then the third component are the 2 inflatable cylinders that are put into the penis, each through very small incisions deep inside the erectile bodies. So these 3 components function as the inflatable prosthesis, all put in through one incision with only a single incision, even smaller, on the erectile bodies of the penis.
Right. So if I'm to summarize what you're saying here, the main points. First of all, it's a fairly short operation.
30 minutes.
In your hands, 30 minutes. Okay, in other people's hands, maybe a little bit longer, but it's a fairly short operation overall. Anatomically, nobody on the outside has any clue that you've had a penile prosthesis. There's no sense of embarrassment in that sense. And from a functional point of view, you induce the erection when you want it. You reverse the erection when you want. In other words, you
Right.
have full control over it.
Right.
You don't lose sensation. Orgasm feels the same. If you ejaculated before, you'll ejaculate
And
afterwards.
the ejaculate looks and feels the same.
And there's absolutely no difference in urination.
None of these components are placed in the urinary system.
Thank you. We appreciate it.
Thank you.
Yep.